According to the CDC, about 1 in 60 children has been identified with autism spectrum disorder. Autism is a lifelong disorder, affecting more boys than girls. Dr. Chau, who specializes in pediatrics at Pomona Valley Hospital Medical Center, explains what autism is, who's at risk, and the treatments.
Autism is a developmental disorder that affects communication and behavior. So signs and symptoms, the major ones include impairment in social interaction and communication, as well as restricted and repetitive behaviors, interests, and activities.
Dr. talks about who is at risk for autism.
Research seems to show that it's a combination of genetics working with the environment to lead to the development of autism. And certain risk factors include having older parents, having a sibling with autism spectrum disorder, being born with a very low birth weight, and certain genetic conditions such as Down syndrome, Fragile X, tuberous sclerosis, and other metabolic disorders.
Dr. discusses when a child should be screened for autism.
Children are recommended to be screened when they're 18 months and 24 months old. Once a child tests positive for an autism screen, they are referred to developmental services to help them with development. They're also referred to a team of specialists to undergo a thorough evaluation to assess whether or not they really do have autism spectrum disorder. For older children, the symptom that tends to be noticed is social impairment. And so parents and teachers generally might be some of the first people to notice these signs in the older children. And so then the school special education team can do the initial assessment and then refer the child to a doctor or specialist who have experience in diagnosing autism spectrum disorder. Because autism spectrum disorder can be diagnosed at any age, adults can also be diagnosed as well. It's a little bit trickier with adults because they can have other conditions that maybe make it hard to tease out. Other symptoms such as if they have like anxiety or ADHD on top of it. But if someone is concerned that they are having signs and symptoms of autism, they should also talk to their primary care doctor, who can refer them as needed to someone who specializes in autism diagnosis.
A wide range of resources are used to help the patient.
There are behavioral and educational specialized programs to help treat the symptoms of autism. Behavioral therapies focus on teaching social skills, motor skills, cognitive thinking skills, and help alleviate or eliminate unhealthy coping behaviors or reactions to the environment. And specialized educational programs also help with developing social skills, as well as language skills, self-care, and job skills, especially for the older children, to help lead them more towards independence. In terms of medications, there are medications that can help with the symptoms that are commonly seen with autism, such as irritability, attention problems, hyperactivity, or depression and anxiety.
The future of treatment is promising for people with autism.
Intensive behavioral therapy, when started during early childhood, and that involves the family in terms of training parents to continue therapies at home, show the best results. There's no single best treatment for autism spectrum disorder because there's a spectrum of symptoms and severity, so it's important that families and people with autism work with their healthcare professional to find the best treatment for them, one that addresses their needs the best. There are up-and-coming research and treatments that will hopefully help even more. Now there have a drug in early trials that can actually or is showing promising results to address the core symptoms of autism. So not just the irritability or the attention problems, but the actual social interaction and communication impairments, the restricted interest and repetitive behaviors.